Mask ventilation is a critical airway management skill in both controlled and emergent medical environments. The demonstration today will illustrate this skill in the operating room from the perspective of the anesthesiologist. Emergency airway equipment must be accessible prior to initiating mask ventilation. This includes laryngoscope blades and appropriately sized endotracheal tubes. Also, a variety of face masks and oral and nasal airways. Examine the patient's mouth prior to selecting a mask. Look for foreign objects, copious secretions, and loose or missing teeth. A mouth inspection, in addition to a full airway exam, is critical for non-emergent airway management. Choose a face mask that best fits your patient. The mask should cover the bridge of the nose and the entire oral aperture. A well-fit mask forms a seal with the facial tissue. If the mask does not form a seal, add air to the inflatable cushioned rim to create a better seal. Denitrogenate the patient. Open the adjustable pressure-limiting valve and turn the oxygen flow on high. Apply the face mask to form a firm seal on the face. Ask the patient to take 5 deep breaths. Check the monitor to evaluate the patient's end-tidal carbon dioxide. This information will verify the adequacy of the mask's seal. At this time, it is appropriate to give the patient medication to induce general anesthesia. Watching the patient closely, examine him or her for signs that he or she is no longer conscious. This includes the loss of the lash reflex, loss of response to verbal command, and apnea. Tilt the patient's head with one hand, extending the neck. With the index and second fingers of the opposite hand, simultaneously lift the chin to place the patient in a sniffing position. One of the most difficult yet important skills for mask ventilation is correct hand placement. Position the left 5th digit at the angle of the patient's mandible. This finger needs to exert sturdy upward pressure to sublux the jaw. At the same time, the index finger and thumb create a C shape around the center of the mask. The thumb and index finger apply firm, but not excessive, downward pressure on the mask's surface. Position the middle finger under the mental prominence of the jaw to bring the jaw upward into the mask using only gentle pressure. With your hand properly positioned, you will maintain correct mask placement and free the opposite hand to apply pressure to the oxygen reservoir bag. With the mask in position, gently squeeze the reservoir bag to generate airway pressures of 25 centimeters or less of water. Assess the adequacy of ventilation. Watch for chest rise and auscultate both lungs, listening for equal and bilateral breath sounds. Substantiate your exam findings by confirming the presence of end-tidal carbon dioxide on the monitor and by measuring exhaled tidal volume. If you have a difficult time ventilating a patient, consider the following hand position adjustments. Apply gentle downward pressure on the mask with the thumb and index finger. Excess force can collapse the airway. Rotate the hand 90 degrees clockwise to pinch the mask between the thumb and 3rd finger, extending the 4th finger to provide chin lift. Apply more pressure with the 5th digit. Jaw subluxation can move a collapsed tongue out of the airway. If you continue to experience difficulty ventilating a patient, consider an oral or nasal airway. To choose a properly sized oral airway, hold the device against the side of the patient's face. The airway should extend from the oral aperture to the angle of the mandible. Gently scissor open the mouth. Depress the patient's tongue with a wooden tongue blade. Align the curve of the device with the curve of the patient's airway and insert it into the mouth. Gentle pressure upward on the airway will confirm placement behind the tongue. The physician holding the mask should stand at the head of the patient's bed. With the appropriately sized mask placed on the patient's face, place the thumb of each hand on either side of the mask. Exert gentle inward and downward pressure on the mask. If you have large hands, place the index finger of both hands at the angle of the mandible and apply upward pressure to sublux the jaw. Alternatively, if you have small hands, you can exert the same type of pressure with the fifth digits of both hands. Manual bag ventilation is provided by an assistant or mechanically by a ventilator. Turn on the ventilator alarms prior to mask ventilation. Continue to monitor for signs of adequate ventilation as done in one-handed mask ventilation.